Namaste. I'm Dr. Siri V. Endometriosis is a chronic painful condition that affects women in the reproductive age group. Here, the pathology is the lining of the uterus, which is called as endometrium. A similar tissue is seen to be found in different parts of the pelvis or elsewhere. So, what happens is every cycle when there is a menstrual bleed, there is some amount of bleeding happening there in those tissues too. So, there is blood which is where it is not supposed to be, which causes inflammation, adhesions of the tissues surrounding it. So, this brings about pain during every menstrual cycle, and this pain will go on increasing with duration. This endometriosis can be missed quite often because initially they present with this menstrual pain, which people might ignore it as a normal pain. So, what happens in endometriosis is this pain goes on increasing with years passing by, and the pain, the intensity, and the duration of pain also goes on increasing in endometriosis. So, that is how we differentiate between the normal pain and this. And there are pain associated when the endometriosis is on bladder, that is urinary bladder. There can be pain during passing urine or while passing motion if the endometriosis is on the rectum or the large intestine. So depending upon where the site is, you can have pain, and sometimes it is seen on a cesarean scar also. So we can see a swelling and a pain at the scar site. The patient complains with every menstrual period. This shouldn't be ignored. Definitely endometriosis affects fertility depending again the severity of the endometriosis. There are different grades of endometriosis. Grade 1 and 2, they may conceive by themselves without any assistance, but stages 3 and 4 will definitely require a fertility expert to look into it. And endometriosis can affect in very different ways. So endometriosis can be there in the ovaries, whereby the cyst could be of a larger size, will affect the quality of the eggs from that ovary, and sometimes because of the distortion of the fallopian tubes, the fallopian tubes will not be able to take up the egg and bring it into the uterus. And even there is endometriotic spots within the muscle layer of the uterus, which we call it as adenomyosis. That will plantation of the embryo that is going to be there because there is inflammation all around in the uterus. So that can come in the way of the fertility. And sometimes there is endometriosis near the cervix. Again, it depends on the location, but definitely endometriosis do affect fertility. As explained earlier, since this mimics, the endometriosis mimics to some extent a normal menstrual pain, they tend to delay coming to the doctors, and hence the damage is already done. So the endometriosis is an ongoing process, and usually when treated early is easier. So there is no complete treatment for endometriosis. There are many methods for treating endometriosis depending upon the need, the age, and the symptoms of the patient. So there is a tendency to not diagnose endometriosis very early, and sometimes it is difficult to pick up on an ultrasound also when the lesions are very small. So there should be a very high suspicion, then only we would be able to diagnose endometriosis in early stages. So in early stages, probably a laparoscopy will be able to help us locate, or even an ultrasound where the uterus is more fixed or the ovaries are more fixed should give us this doubt that there could be some sort of endometriosis, or sometimes the follicles don't rupture and during the ovarian stimulation. So all this should give us a very high suspicion rate of trying to check for endometriosis. Then the diagnosis is possible. There is no definitive treatment for endometriosis, but the first line is always for the pain management. We give some painkiller tablets, antiprostaglandins, which will reduce the inflammation and pain. But when we are looking for more of fertility, then it would be a more aggressive approach, that is mostly surgical, where we would want to clear out the endometriotic cysts or the adhesions that are there, which is coming in the way of fertility, like maybe ovarian adhesions, the tubal blocks, clipping, and the endometriotic cyst removal, which will improve the fertility to a larger extent. So otherwise, for a long-term therapy where we need to just manage the pain, there are many hormone injections which will suppress the menstrual cycles itself. But the disadvantage of all of them is that they cannot be used for a very long time. We cannot suppress the hormones for a very long time, but for very short durations, we give those injections. And the couples who are planning for a pregnancy, having a pregnancy and delivery itself could be a very therapeutic effect on endometriosis, since the patient will not be having periods for the 9 months, and following the childbirth again for at least 3 to 5 months of no period itself will suppress the endometriosis that is already existing, and could be very therapeutic. So we usually ask them to plan for a pregnancy early without postponing further.